All right, everyone. So today we're talking about a prepectoral subfascial breast augmentation. So this lovely lady, we talked about placing a high-profile implant. So a couple of nuances of this. You guys can see the on-table results. So a couple of key points here is that she has really nice upper fold volume and that really perfect cleavage. We want to make sure that the base width of the implant. So if you come here, a typical implant is a circle when it's lying down. So we measure something called the base width. So we want to make sure that this base width fits right perfectly within the base width of her breast, and everybody's base width is different. So that's where taking objective measurements and tissue-based planning is extremely critical. We want to make sure that this nipple to fold distance is consistent with the size of that implant. The base width is consistent with the size of the footprint of the breast. So all these little measurements are extremely critical to creating an excellent result. So we created the pocket. We want to make sure that we don't over dissect laterally, and that we get right into the midline without over dissecting medially. So we don't want to create symastia. So this is an extremely important landmark. You've got your manubrium over here, the breastbone, and you want to make sure that you're as close to that without disrupting these ligaments over here. Otherwise you get symastia, which we're not going to do. And we don't want to overcorrect laterally so that you have lateral migration. So creating that perfect pocket is a critical step when doing this thing. The other thing I want to talk about is the incision. These incisions are really discreetly hidden right in the inframammary crease. And in order to create a really nice scar, we want to take the tension off of this incision as the weight of that implant loads that incision over the next few weeks. And so this is a multi-layered closure. You've got deep sutures that are reapproximating scarpus fascia, and then you've got deep dermal sutures and a subcuticular stitch. So basically there are belts and suspenders that are really keeping this incision offloaded so that the weight of that implant doesn't open this up and stretch it out and create a hypotrophic spread scar. So this is going to be a great looking scar. And we're all done here, but you can see our on-table result. Great cleavage. The muscle is not in her way, so she'll have no animation from this, and an easy recovery because we're pre-packed. She'll have no pain.